The Ministry of Health is considering administering a second booster shot against COVID-19. Countries like the United States, United Kingdom, and Israel have been administering the second booster dose. The matter was raised at the ministry's COVID conversation last evening. Shamela Pullen has our report.
Jamaica is way behind in its vaccine program against COVID-19. With just 25% of the population immunized against the virus, it is clear the country will not reach the 70% target issued by the World Health Organization. Thousands of vaccines are going to waste, yet consideration is being given for a second booster shot.
We are reviewing our position on that currently, so our team will look at that. We have recognized that some countries have started to give a second booster, and for persons they have indicated the age group. Some it's over 65. I see some as low as over 50. So we are looking at that, and we will make a position on that clear.
Public health experts believe a second booster shot is not a bad idea, particularly given that the Omicron variant is the more dominant strain of the virus.
After 2 doses of AstraZeneca, the effectiveness dropped from 50% to 0 after 25 weeks. After 2 doses of Pfizer or Moderna, the effectiveness dropped from 70% to 15% after 25 weeks. 2 to 4 weeks after a booster for all vaccines, the effectiveness against infection ranged from 70% to no effect after 20 weeks.
With another surge being predicted, the elderly and healthcare workers remain vulnerable.
For the month of March, I saw no COVID suspicious cases. Over the past 3 days, I have identified 5 COVID suspicious cases, and they were referred to the Ministry of Health. Therefore, there was no doubt in my mind, based on what I'm seeing in my practice and what is taking place around the world, and the rise in positivity, that we are entering the 5th surge.
104 of our health centers island-wide, 28 in the Southeast Health Regional Authority, that's KSA, St. Thomas and St. Catherine, 14 in the Northeast region, Portland, St. Anne and St. Mary, 34 in the Western region, that's Hanover, St. James, Trelawney and Westmoreland, and 28 in the Southern region, that's Clarendon, Manchester and St. Elizabeth. And there are also 21 private vaccination sites in operation and 16 private doctors administering vaccines. So really there is no excuse.
Out of the over 600,000 Jamaicans who are fully vaccinated against the coronavirus, only 32,823 people have received the booster shot. Shamela Pullen, TVJNews.
And Health Minister Dr. Christopher Tufton continues to defend the government's decision to relax the COVID-19 measures. The measures were lifted a few weeks ago.
The truth is, none of those positions that have been taken are unusual in the case of the globe. Most of the world have gone in that direction in recognition of the need to address some of the other glaring challenges that societies face around the world. It is important, though, to recognize that as individuals, as Jamaicans, we must assess our own risk, our personal risk. And where masks we think are necessary for our own protection, we should wear it, or for the protection of others if we're sick, if we're sneezing and coughing.